Today, we are going to be talking about malaria in Kenya, a disease that continues to shape the country's history, politics, geography, and socioeconomic conditions. Malaria is not a new problem in Kenya. In fact, the first recorded case dates all the way back to 1888, and since then, the disease has continued to spread throughout the country. Even with modern medicine and national programs, malaria still remains one of the most serious public health concerns Kenya faces today. Throughout the 1900s, malaria was widespread mainly in Kenya's warm, low-lying regions. But as the climate changed over the century, malaria started spreading into the highland areas, which has once been too cool for mosquito survival. By 2011, Kenya recorded 3.4 million cases and 12,000 deaths. In 2021 alone, malaria caused 19% of all hospital admissions and over 10,700 deaths. This shows that malaria isn't just a past issue and continues to have a major impact on Kenyan life. A major reason malaria is so persistent is due to Kenya's climate and environment. Malaria is transmitted by the Anopheles mosquito, especially the Anopheles gambiae species. This species is extremely efficient at spreading malaria and thrives in warm and humid environments, which are common in Kenya. Transmission increases sharply when temperatures reach about 18 degrees Celsius because mosquitoes become more active and the malaria parasite develops faster inside of them. Kenya's rainy seasons, especially in arid and semi-arid regions, create standing water that becomes breeding sites for mosquitoes. Flooding makes things worse, leading to spikes in malaria cases because of this dangerous environment. Climate change has intensified these trends. Higher temperatures, unpredictable rainfall, and more frequent storms allow mosquitoes to survive in new areas. This means malaria is spreading into places that historically it has not before. The Kenyan government recognizes malaria as a national priority. To respond, they have developed systems for mapping malaria risk zones, forecasting outbreaks, training health facilities, and delivering community education programs. For example, the Kenya Malaria Strategy in 2023 to 2027 outlines the country's current plan, which includes prevention tools, improving maternal and child health services, and epidemic preparedness. Another example is large-scale public campaign, The Power of Every One, launched in 2024. They aim to mobilize entire communities to participate in malaria prevention. However, even with the strong planning, Kenya faces challenges. Rural areas often have limited health resources and unequal access to prevention tools, and depend heavily on funding from global partners. For example, 83% of people already own bed nets, so the challenge is no longer giving them out, it's making sure they are consistently used by everyone in order to have effect. Malaria is not just a health issue. It is deeply connected to poverty and economic stress. Kenya's national debt has increased by 19.3%, which limits how much money can be spent on health services. Many people live below the poverty line and must choose between food, transportation, or medical care. One example comes from Jennifer Sarinke, a mother in rural Kenya. She lives in one of the most arid regions, where droughts have destroyed crops and livestock. With no stable income, even the 20-kilometer trip to the nearest clinic is often unaffordable for her. As a result, many women give birth at home without medical support, and children miss important vaccinations. These challenges make malaria harder to prevent and treat. Most vulnerable age groups are children under 5 years old because their immune systems are still developing, pregnant women who face risks such as anemia, miscarriage, preterm birth, and low birth weight. Malaria is responsible for tens of thousands of childhood and maternal deaths across Africa each year. Having reached high levels of bed net ownership, the problem is now likely to be the use of bed nets, not their availability. Another quote, in villages along Lake Tanganyika, Tanzania, 87% of households surveyed had used a mosquito bed net for fishing at some point. This is a graph of the bed net usage over time, which tends to go up over the years, and malaria prevalence in under 5 children, circa 2019. Despite these challenges, Kenyan communities have been actively involved in prevention. Examples include cleaning up standing water, improving waste removal, installing window screens, using bed nets correctly, spreading community-level education, planting trees and redesigning outdoor areas to reduce mosquito habitats, and community engagement works. In one study, 91% of residents said they heard malaria messages through education campaigns. Local involvement makes prevention efforts more effective and more sustainable over time.
Budget and solution. The first step is securing funds for the textbooks. These materials teach communities how malaria spreads, how to prevent it, and why early treatment matters. With better education resources, knowledge becomes a powerful tool for protection against malaria. After the communities have this new knowledge, we must then distribute the bed nets for people to use properly. As shown on the graph, there is an increasing amount of people using bed nets, but as we found out, they are not using them for the intended purpose. It is not the level of ownership that is the problem, it is how people use the bed nets. There is a study done in a small village in Kenya about how bed nets are being used. The study found out that 87% of households had a mosquito net but used it for fishing at some point in time in their ownership of the bed net. This goes to show that the problem we need to solve is educating the people of Kenya about how to properly use the bed nets and what the safest way to live would be. Here's a picture of the bed nets they would use for fishing.
Signs and symptoms of malaria include fever, chills and shivering, headache, nausea and vomiting, dry cough, sweating, muscle fatigue, and/or joint pain. This is an example of a mosquito. Malaria's impacts extend beyond Kenya's borders. The CDC requires travelers to Kenya to take malaria prevention medication before, during, and after their trip, showing how high the risk is. Clinically, malaria is dangerous because it multiplies quickly in the liver and then the red blood cells. This complex cycle makes malaria difficult to eliminate even with good medical care. This is the annual incidence of malaria cases in Kenya and temperature. To summarize, malaria in Kenya is not caused by one single factor. It is the result of historical patterns of disease, geological and climatic action conditions, political and public health systems, and socioeconomic inequalities. The disease continues to impact millions of people each year, especially children and pregnant women. But Kenya is making progress through community action, national strategies, and global partnerships. The path forward will require sustained community engagement, equitable healthcare access, and long-term political support. Eliminating malaria isn't just about killing mosquitoes. It's about strengthening communities and building a healthier future for the people of Kenya, which will not be easy, but if everyone works hard, is possible. Thank you.